Well, I think I look at it now as a recognition of symptoms so that an allopathic physician, your GP would, you'd come with a series of complaints, headache, visual changes, um, and they'll consider something in your central nervous system. So pretty much at any given time, I have somebody show up with all of those complaints at one time, and they have breast implants. So basically, if you do and check the boxes for just symptoms as a physician, all of my patients check almost a box or two or three in every single category down the body. It's chronic inflammation, uh, how we deal with it for the cancer patient or the cosmetic patient doesn't vary as much. And then we do our testing, which is part of our holistic accelerated recovery program, check their genetics, their toxicity profile, their gut microbiome, their hormone status, and look at a food sensitivity test to see what triggers can we take out of their day to day that will help reduce their inflammation right off the bat and adjust their diet and take gluten out and take dairy out and processed foods and decrease sugar.
Quite
Nice.
frankly, if you have a breast cancer diagnosis, those things should be out of your diet anyway.
The implant's just one of them. And if you don't address the other drivers, you're still going to be struggling with things potentially down the road based on how you detox genetically or what toxicity you already have, or maybe you live in a home that has mold, or there are just all these other things that if you don't take into consideration, you're going to have a prolonged recovery or not recover in the manner we see normally.
And we do still hear stories all the time about people who had suspected breast implant illness and then they went and had their implants removed and they didn't improve. And so
Right.
I guess what you're saying is that there are other factors happening there and the implant is just a part of it, but that you have to address all these other things.